Not many people know this, but I'm an electrician in a past life, and being an electrician, we used to carry around a tool bag. And as much as this may sound a bit strange, I often think of myself as a physiotherapist being a little bit like that electrician. I have a tool bag, and that tool bag is not a literal tool bag anymore. It's more of a mental tool bag. So it's the knowledge that I've gained over many years of experience. And that tool bag allows us to do multiple different types of treatments with lots of different treatment techniques. So I'll often have therapists people will come in and say, I've been to a therapist and I've had back pain and I've had this type of treatment, and then I've gone in and I've had a different type of pain, I've had the same type of treatment. And I often find that quite strange. It's like having the magic elixir. It's if you've got a cold, you take this fluid, and if you've got a headache, you take this fluid, and if you've got a sore ankle, you take this fluid. I don't think any one thing can fix all things. What I see a good therapist having is a multitude of different types of techniques to help with different types of conditions. So I'll just name a few conditions that we treat on a regular basis. We look after people with disc injuries. We look after people with facet joint injuries. We look after people with ligament injuries. We look after people with muscle issues. We look after people with neurological issues. We look after people with biomechanical issues. So if I'm treating a person who has a disc irritation, I'm going to use a different manual therapy technique and quite often different exercises or the active therapies than someone if I was treating with a facet joint. A facet joint technique would be different. The facet joint techniques may involve much more manual handling, forcing onto the facet joint itself, being more physical, releasing the overlying muscle tissue, and maybe even the associated nerve tissue, and again, exercise or active therapies. Whereas if the condition is nerve-based, then there are definitely different techniques that need to be used. You just cannot use your standard manual therapy techniques for neural tissue irritation. It's much more sensitive, and if you don't treat the nerve with respect, it's going to bite you back quite severely. And then of course there is your strains and your sprains of ligaments, muscles, and the other types of soft tissues. And again, different types of techniques are utilised for those. So having one technique to try and solve all those problems is, I think, an issue. I don't think you can use one technique to resolve all issues. This leads me to the act of manipulation. Some people will know it as the cracking or the snapping of the neck or the upper back or the lower back. And unfortunately, I find that there are some therapists out there who tend to use that as the panacea of all cures to fix everything that goes on. I personally do use manipulation as a technique, but it is something that I use when it's necessary. The actual art of manipulation is not that difficult. I could teach anyone to do it. The true art in manipulation is knowing when it is appropriate and for what condition it is most appropriate for. Manipulation is something that I have used on a regular basis and will continue to use for those people who are most appropriate. And generally it's for those people with a bit of stiffness in the joints that I can't get moving, or I'm not getting moving in more traditional ways. It is a forceful thrusting technique, so it's a little bit more dangerous than the other techniques that we use, and therefore again, part of utilising that technique comes with the responsibility of you as a practitioner making sure that person is very appropriate. The last thing you want to do is start using manipulation technique on someone with a high level of osteoporosis or has some sort of disease condition that may make their bones susceptible to damage. One of the I call the party questions I get often when I go out to parties is, well, what is the noise? Why do the joints crack and pop all the time when we do a manipulation? And Look, there are some people who've done a little bit of research into what the noise is, and some people talk about air bubbles popping in the joints and bits and pieces. But the reality is, joints throughout your body will make snapping, clicking and clunking noises. They're just very naturally occurring. Most of the time we don't notice them. Sometimes we do. I used to do lots of squats for exercise, and I used to be called the Caracas Kid because my knees would click and clunk. It's not an indication that there's anything necessarily wrong unless it's associated with pain, but that noise is just part and parcel of what joints do. We'll do manipulation on a regular basis and they will make that fairly loud clacking noise. The noise comes about when you move the joint through its full range. I've heard people come in and go, oh, when you're cracking that, you're pushing the disc back into place, or you're moving my bones back, or realigning my spine. And if you have any base knowledge of anatomy, you know that the spine is an extremely stable device. It does not, bones do not slip in and out of place, discs do not slip in and out of place. But the side joints called the facet joints do move, and that's what we're doing with manipulation. Manipulation moves the joint through its full range from end to end, and because there's a rapid change in the pressure within the joint, you get this kind of sudden clicking or cracking noise occurring into it. And so all you're really doing with the manipulation is encouraging that joint to move through its full range, and hopefully that if that joint's been a bit on the stiff side, then you'll return it back to its normal function. You haven't realigned the spine, you haven't fixed the disc bulge or popped the disc bulge back in, or fixed up a scoliosis. Well, that's another one. Fixing scoliosis is, I've got to come back to that. All we've done is move the joint through its full range and it's made a clacking noise. And now it's a bit more mobile, and hopefully that will relieve you of some of your symptoms.